Hey, Vanessa. Oh, I can't see your email.
You can. There's one person that did not get the link. He had just emailed me, so I'm gonna stop screen sharing really quick and send that link to him. So hold on.
We'll get started in just a minute. We have people rapidly joining, so we're just trying to get everybody admitted before we start.
Okay, I think we got it fixed. Are you all seeing my screen now, the PowerPoint?
Yes.
Okay, thank you. Lee, do you feel like we are ready to get started based on what you're seeing, or do we still have a high volume of people entering?
We still have several joining like all at once.
That's fine. We'll give it another minute or so.
It is starting to slow down now. If you want to go ahead and get started, I'll just keep watch.
Okay, thank you. Well, welcome to the RIAC Workshop. My name is Vanessa Brewer, and I am the Regional Interagency Council Program Administrator, and I work at the Department for Behavioral Health, Developmental, and Intellectual Disabilities. And we are really excited to have you here with us today. I want to thank you for joining us. I want to thank you for your interest in taking a deeper dive into RIAC and for your input on the survey that truly helped us guide the development of this workshop. So just a few housekeeping things to go over before we get started. If you haven't already, please mute your mics just so we don't get additional feedback. I believe we've got about 98 people signed up for this workshop today. Also, this is a 3-hour workshop with one 10-minute break built in. You guys are lucky we didn't do that on the last workshop, but we did listen to the feedback that we got and we did build in a break. It's towards the latter part of the workshop, but please feel free to take care of your needs as necessary. This workshop is being recorded and we will plan to share it at a later time as long as technology cooperates. There is a Q&A box, so if you have questions along the way, please feel free to use that. Lee is going to be monitoring that Q&A box throughout the workshop. And we've also carved out some time at the end for Q&A. All right, before we dive in, we would like to know who is with us in the audience. So we've got a poll that Lee is going to put up there. And if you could just take a few seconds to read over that and just select who you are representing today. All right, can everybody see that poll? I can't see everybody because I'm sharing my screen. Lee, is there a way from?
Yeah, I can share it. I was waiting. There's still a few people that haven't responded. But maybe people aren't going to, so we'll go ahead and end it.
So we've got a wide variety with us today. Several of the mandated member agencies from RIAC, and then a few others. We're glad to have you here today with us. Thank you for joining. All right, if you've been around for a while, you know that over the past several years, there have been some significant changes to the purpose and the responsibility of the RIAC. So before we move into RIAC 2.0, I'd like to spend a little bit of time talking about how we got here. So in the mid-1980s, Kentucky agencies that work with children and transition age youth began to recognize the lack of programs that existed to serve the seemingly ever increasing number of children with behavioral health needs. Due to the lack of alternate resources, children were being placed in psychiatric hospitals and costly out-of-state residential programs at a higher level of care than what was needed. And so placing the child outside of the community was often necessary, which made it difficult for parents and families to stay involved with the child's treatment. Around this time, an innovative work titled Unclaimed Children, The Failure of Public Responsibility for Children and Adolescents in Need of Mental Health Services was published by Jane Nitzer. And this publication outlined principles and values for the Child and Adolescent Service System Program, which is also known as CASP, which is a comprehensive community-based service model of service delivery. So due to the lack of, just a second, my apologies. Due to the lack of resources, Kentucky leaders were anxious to create a new service delivery system for children with behavioral health needs. And in 1989, Kentucky applied to the Robert Wood Johnson Foundation to fund Bluegrass Impact in 17 counties. Bluegrass Impact was a successful demonstration of the use of the core components of the child and adolescent service system programs, such as individualized service planning, involvement of parents, service coordination, wraparound supports, in-home therapy, and non-traditional creative ways of meeting the needs of children and their families. In 1990, Kentucky Impact went statewide, and legislation was created that established the State Interagency Council, also known as SEAC, and the Regional Interagency Councils, also known as RIACs, and local interagency councils, also known as LIACs, to carry out the work of impact in all 120 Kentucky counties. In 2012, the Secretary of the Cabinet for Health and Family Services charged child and family serving agencies with realigning the way behavioral health services and supports for children, transition age youth, and their families were accessed, delivered, and reimbursed. And in 2013, a SAMHSA grant was awarded to Kentucky for system of care expansion, and the funding was intended to redesign the services to families and to children to be more timely, integrated, and effective. So during this time, Kentucky implemented a state-run health exchange, and MCOs providing physical and behavioral health to Medicaid-insured individuals in Kentucky were charged with authorizing targeted case management services based upon medical necessity. In 2014, Kentucky established behavioral health service organizations, Senate Bill 200 was signed into legislation during this time that supports the use of community-based services to facilitate early intervention and to hold youth accountable to achieve better outcomes for youth and their families. And also at this time, RIAC and LIAC's task changed from serving as the gatekeeper of impact services to operating as the local governing bodies for the system of care across the state. And around this time, SEAC and RIACs began to increase efforts to strengthen family and youth voice, coordinate services using interagency involvement and collaboration, promote the use of community-based services, and move towards becoming culturally competent, outcome-based, and encourage the use of evidence-based practices. SEAC members sign an interagency agreement recommending that its member agencies embrace a public health approach to children's behavioral services, and that each member agency adopt the system of care core values and guiding principles. In 2018, new legislation went into effect that changed the requirements of DCBS serving as the RIAC chair to any voting member of the RIAC by majority vote. So please note, though, that although DCBS was not required to serve as the chair after this, they're still a mandated member of the RIAC. Other changes to the legislation included additional mandated members to the RIAC, such as the youth representatives, representation from the Office of Vocational Rehabilitation, Friskies, and the Special Education Cooperative. And also during this time, RIAC functions were modernized to support system change and practice change for the overall goal of improved outcomes for children, youth, and transition age youth with or at risk of behavioral health needs and their families. So as stated, the new legislation that went into effect in 2014 and strengthened in 2018 supported the shift from individual level supports to system level supports. And so the mission of RIAC is to promote healthy children and transition age youth across Kentucky, to build a collaborative system of care to promote children's and transition age youth social, emotional, and behavioral well-being where they live, learn, work, and play. And so through the RIACs, we want to collaborate with system of care partners to intervene early to increase the likelihood of positive outcomes, including early ages and earlier in the progression of mental health conditions. We want to incorporate screening, early identification, and intervention into service array. We want to identify and address problems in high-risk populations and optimize mental health for all children, and increase the emphasis on providing or linking with mental health promotion and prevention. So as we discussed, the mission of RIAC is to build a collaborative system of care to promote children and transition age youth social, emotional, and behavioral well-being where they live, learn, work, and play. So it's important that we define what we mean by a system of care. So a system of care is a spectrum of effective community-based services and supports for children and transition age youth with or at risk of behavioral health needs and other challenges and their families, that is organized into a coordinated network that builds meaningful partnerships with families and youth and addresses their cultural and linguistic needs in order to help them function better at home, in school, in the community, and throughout life. So it's important to note that system of care is not a model or a program that can be replicated, but instead it's an organizational framework for creating sustainable system change. It's also a value base for services and supports. So agencies are collaborating instead of operating in individual silos. This coordinated network views youth and family with lived experience as stakeholders, involving them in the assessment, planning, and implementation and evaluation of system of care efforts. And they meet families and youth where they are, addressing their cultural and linguistic needs. And Kentucky is one of few states with an organized infrastructure focused on the development, implementation, and oversight of the system of care. So under the new legislation, RIACs are tasked with operating as the local governing bodies of the system of care. So they provide a structure for the coordination, planning, and collaboration of services and supports at the local level to children and transition age youth. So bringing the experts together to discuss the needed services and supports for children and transition age youth with or at risk of developing behavioral health needs. This structure builds on existing resources of local public and private agencies and community partners within the community to support sustainable policy, practice, and system reform in order to improve the larger system of care for Kentucky's children, transition age youth, and their families. And so just to clarify, because this can get confusing, RIACs are not responsible for developing needed services as identified by the RIAC, but instead RIACs are responsible for identifying service gaps and needed supports and working strategically with system of care partners to find solutions to the service gaps. All right. I don't want to spend too much time on this slide, but it's important to note who the target population of the system of care that we're talking about is. So the target population for the RIAC is children, youth, and transition age youth being youth between the ages of 16 and 25, with or at risk of developing an emotional disability, substance use disorder, or mental, emotional, or behavioral need, and their families. So hopefully by addressing the needs of this population, we can increase protective factors and decrease risk factors for all children, youth, and transition age youth associated with many of the issues that we see in our community, state, and nation today, such as behavioral and emotional problems, suicide rates, substance use, truancy and absenteeism, stability of living situations in children and youth and out-of-home care. These are just to name a few. So I'm going to go ahead and turn it over to Joy Varney. Joy is our family engagement coordinator with the department, and she is going to talk with us about the system of care core values and guiding principles.
All right, well, thank you, Vanessa, and thank you everyone for being here today and spending time with us and being able to learn about the Regional Agency Council and what it involves and you know, a little bit more about it, like Vanessa said, into a deeper dive. So I'm going to talk a little bit about the system of care core values. First of all, I'm going to do an introduction. So my name is Joy Varney. I'm the Family Engagement Coordinator at the Division of Behavioral Health. And I've been on several RIACs before, so you might have seen me pop on. And if you have and I've met you, then it's good to meet you. And thank you for allowing me to be able to sit and join. I've been in the advocacy field probably near 20 years. I have a son who has substance use and mental health disorder. During his youth, we walked a long road together, him on his journey of addiction and mine on a journey of a family member trying to cope with their youth in addiction. I'm also, I'm a family peer support, but I'm also an adult peer support because I have substance use and mental health disorder as well. I walk my recovery or try to every day. And some days are just a lot easier than others. So I've been around the block a few times and I feel like I know enough, just enough to be dangerous. And so I'm going to share what I know about the system of care core values and principles. So when you all were asked to sit on the Regional Interagency Council, I don't know, we have 77 participants on. When you were asked to sit around the Regional Interagency Council, I'm wondering if when somebody asked you, you knew what a RIAC was, or did you know what the system of care core values were, what it stood for? A lot of folks, and it's okay, did not know. And so they come to a meeting and it takes a while to learn about it. And so if you're still trying to put the pieces of the puzzle together, it's okay. You're going to get there because I got there. If I can get there, you can get there. But sometimes it just takes time. And I'm glad we've got Vanessa and Lee to be able to help put those pieces of the puzzle together for us in what we do with RIAC 2.0. So when you think of the system of care, because it's like I said, it's taken me a long time to understand system of care and what all it entails. But what helps me is to put it in context, in a place on, you know, to fit it to where I could understand it. And so when I think of system of care, I think about the RIACs that you participate in, all those child serving agencies sitting around that table, including the family and the youth, to be able to come up with solutions for barriers, to identify gaps and needs, to find out about strengths. And so for me, that's just a way to put it. So if you're trying to think, oh goodness, what is a system of care? Think about your RIAC, or if you know about wraparound, think about it in terms of your wraparound. It's much more complex and bigger than that, but it'll help put the pieces of the puzzle together a little bit easier, or at least it did for me. So for me, what I've learned is that system of care is like a state of art and means something very specific in the children's mental health world. So it takes some of those fragmented services and it helps to bring in a coordinated service delivery. It takes some of that categorical funding and programs, and it helps with the blended resources. So more agencies are together putting their resources together to help with a more comprehensive service array, instead of having limited services based on what your agency can provide. It keeps its children out of home, but is keeping children in their families. And it is fostering and building the strengths and the resilience of families instead of fostering dependency. So if you think about it, it's like what Vanessa said, the system of care isn't a program. It's more of an attitude. It's more of a philosophy, and it's more of the way that we think about things. It's like a paradigm shift in thinking. It's asking what's strong and not what's wrong. You know, it's asking what happened to you and not what's wrong with you. It's a fundamental change in approaching underlying assumptions with families and youth that you serve. It consists of 4 values, and I'm going to talk about that here in just a little bit: the youth and family driven, the culturally and linguistically responsive, community-based, and the trauma informed. And I'm also going to talk a little bit about the 12 guiding principles. And if you think about the families and youth that we serve traditionally, families and youth are involved in several different systems, many at the same times. Families are pulled together in so many ways at times that the help that we offer them can become a hindrance. And so system of care helps to address some of those barriers in which families and youth face that maybe sometimes block their way into services. So we're going to talk a little bit about that. Am I going at a decent pace? I thought I'm just going to keep on rolling. If you have any questions, please put it in the chat, or any questions, raise your hand, or whatever you need to do. All right, so next, Vanessa, please. All right, so one of those core values is a youth and family driven system of care. So wow, that's a lot of words. And so what does that mean? So youth and families are involved in implementation activities, such as choosing culturally and linguistically appropriate supports, services, and providers, setting goals, designing, implementing, and evaluating programs, monitoring outcomes, and partnering in funding decisions. So what does that look like? So I'm going to stop a minute and just talk about that for just a second. So what does that look like operationalized? It's wraparound. It's your regional interagency council. It's those family and youth organizations. It is cross-system communication and partnership, certified family peer supports in different agencies, youth peer support, families at evaluators, right at the baseline. So there's many different ways that we operationalize what that looks like in having families and youth involved in implementation activities. So to continue on, youth and family driven system of care engages supports that youth and families with lived experience are trained and hired as peer support professionals to decrease gaps, help in retention of services, and let other families and youth know that they are not alone. So what does that mean? It's that we hire families and youth to be a part of a person into the mental health agency or different agencies and their staff, and they are able to share their lived experience to be able to say, me too. We, as far as sharing of lived experience and being there to be able to help to decrease gaps, I worked with peer supports for quite a long time, and I've been in the advocacy field for a long time. And I had the opportunity to do some in-reach with an individual. She was a young mom and she was incarcerated. And so I was able to, before she ever got out of jail, I was able to go in and visit her. She didn't know who I was. I didn't know who she was. And I went and I met her, and I was up with that glass with the phone. Felt like I was on CSI or something. So I was talking to her, and I told her a little bit about my lived experience, and told her that she wasn't alone, and that, you know, I would be available to help her find those services and whatever that she needed to get better. So when she got out, I was there waiting for her, and then I was able to sit with her in the waiting room until the therapist got there. The therapist I introduced, I did the warm handoff, and she got some of those services that she really needed. And so the thought of somebody coming up and saying, wow, you know, you're not alone. And it made a real difference in that person's life, in that young mom's life. And hopefully today she's still doing good. I've not talked to her in quite a while, but I think about her and what a difference just helping to walk somebody into services will do, and how a parent or a youth with that lived experience at the service delivery level can do that and increase outcomes, better outcomes. So youth and family driven means that family members and youth are engaged, supported, and respected as equal partners. Their voice and lived experiences add valuable perspectives in planning, implementation, and monitoring, which results in shared accountabilities for outcome. So when I look at that paragraph, the key words that get me, that really kind of resonate with me are engaged, supported, respected, and equal partners. And so how as a RIAC, how as a system of care, do you do that? How do parents partner and how do providers partner? Well, we level the playing field for families. So when families are on committees, we orient our members, we orient the parent and the youth members, we give them information. We involve families and youth at the pre-planning of some type of event or action plan or an idea that RIAC comes up with. We include them in the pre-planning stages. We're transparent and our communication is open. We encourage and seek input, use clear and inclusive language. You know, when we're sitting around committees, a lot of us have different lingo, acronyms. And sometimes, I mean, when you're sitting around a different committee of different agency partners, you don't know all the acronyms that are being talked about. And that goes for anybody. So it's really kind of speaking that clear language. And for family, it's stopping and saying, excuse me, can you please tell me what that means? So that is how some of the ways, as you're working with the families, working with and not for the families, to keep them feeling supported in that youth and family driven core values. Vanessa, next, please. Okay, so the next core value we're going to talk about is the cultural and linguistically responsive system of care. And I pulled a quote out. Well, it ensures services are developmentally, culturally, and linguistically responsible or responsive with agencies, programs, and services that reflect the cultural, racial, and ethnic and linguistic differences of the populations served. So I found this quote, and it's by a Dr. Udo, UDO, PhD from Northwestern Health Sciences University, and he wrote this on culture. To be culturally competent doesn't mean you are an authority in the values and beliefs of every culture. What it means is that you hold a deep respect for cultural differences and are eager to learn and willing to accept that there are many ways of viewing the world. So if you think about it, each one of us is different. Each one of us have different set of fingerprints. Each one of us are unique. And so culture affects that our uniqueness. And so culture will influence a way that a person, an individual that we're serving, views mental health symptoms. Culture will affect the way the families describe mental health or physical health symptoms, communication, and culture can influence how individuals respond to different treatments. So it really does affect the way we're working with families, and to be aware of the cultural differences, and for providers to be curious about a person's culture, because when you're open-minded and you're curious, you learn more about that person. So our culture, it affects many aspects of our personalities and behaviors, like I talked about a minute ago, that we are not even aware of, because it is such what I call our natural gait in how we do things. It's a part of who we are, but you know, it influences the way we see time. It how we develop trust in people. Our cultures dictate that. How we make decisions, how we take risks, how we communicate. It dictates how people seek help, and how people work to achieve goals. You know, I remember, you know, my mom is Japanese, and so she's this little Asian lady, 4'9", soaking wet, 100 pounds, but she demanded respect. And up until the day she passed away, I was a little bit scared of her, and Lord knows I respected her, you know. But when I was going through my challenges, I wanted to seek therapy, but she was mortified that I wanted to go out there and tell my problems to a stranger, because in our culture, there's pride. And you just don't do that. And it took a little bit, you know, probably moving out to be able to resolve some of that. But, you know, it's all in the way a person, what they value. And so to get to understand how a person develops trust, and to see how a person, how they make decisions, or how they communicate, or how they seek help, you got to be curious. You got to build relationships. You got to be engaged, and you got to have an open mind to be able to get feedback from families, to build the trust of families. But you know what? And relationships don't happen the first visit, the second visit, maybe not the third or the fourth, but you know, it's a keeping on, and it's being resilient and not giving up, and learning about that family's culture, and seeing what makes them tick. So next, please, Vanessa. All right, so community-based system of care, core values, it's community-based. So it ensures appropriate care options are available close to home. And, you know, sometimes the services in the home and the community, is the way to go, because that's what our youth and our families are familiar with, and what their safety net, or what our safety net is in our communities with our tribes. And there are times where, you know, maybe youth do have to leave the community. But when that happens, you know, we need to make goals as soon as possible and get our families back in the community where they belong. It ensures high quality services are accessible to families in that least restrictive, clinically appropriate setting possible. There, you know, we have many different programs in Kentucky, mental health programs. There's your outpatient, where, you know, a person will walk in, wait for a therapist, go and have their therapy, leave and go home. A lot of our families, youth, individuals that we serve, there might be a lot of barriers to coming into an office, sitting down, seeing, you know, a provider in that traditional setting. So one of the ways we access is, you know, we go out to where the families and the youth are. So, you know, and that helps to ensure some of those quality services. It's also blending resources and with different agency partners, just to be able to, you know, have a more robust type of setting and treatment option recovery source. It also requires systems to see the home, school, and neighborhood of the family from an asset perspective, and to identify the natural supports in these familiar surroundings as part of the strengths-based approach. And so, like I said, I've been around the block, you know, for going on 20 years, and I've experienced and I've seen and met a lot of individuals, and I've met a lot of the heroes, the service providers who have helped and were resilient and were right along with them as they were going in their recovery journey. And there was this one case manager who was working with the youth. And, you know, one of his challenges was he was isolated, and what he needed was a place to hang out, which was a safe place. And so in her community, what he liked to do in his community, he liked the local donut shop. He liked their donuts. Like, who doesn't like donuts, right? And everybody needs a donut every now and then. And so whenever she would see him, about once or, you know, twice a month, she would take him to the donut shop. And they would go in, you know, and eventually, you know, and it took a little while, but eventually she didn't have to go in with him. She didn't have to take him. He went in on his own, and he found his own tribe, his own, you know, setting, the folks that made him feel safe. And he became a part of that donut shop in the community. And just think about the life and how it was changed because he was able to connect with people who cared in his community, in his environment. So community does make a difference. And so while you're working with the folks that we're serving, keep an eye on strengths, what they like to do. There's a youth that loves football. And so what happened, you know, we got him into football and he took off, and it's a part of his recovery journey now, you know. And so it's really bringing that community, home and school together, and again, seeing it from an asset perspective. So we'll take a seat. Next, Vanessa, please. So it's also a trauma-informed system of care. It recognizes the potential presence of trauma symptoms and acknowledges the role that trauma plays or may play in an individual's life. And I was doing some research, and I hope the statistics are somewhat right, but it says the prevalence of a traumatic stress among the general population is high. 70% of adults have experienced some type of traumatic event at least once in their lives. And I'm of the belief, if you're living, you know, you will experience a traumatic event at least once in your life. I don't believe as a human being that we can get away from that, but there are some people's trauma that we might not ever, that runs deep. And so we've got to recognize that as we're working, with our families and youth. Trauma-informed system of care fully integrates knowledge about trauma into policies and procedures and programs. So, to think about it, it's integrating into, like, for an example, agencies will integrate with staff training on trauma-informed care. It will put policies into place to really think about and put into practice procedures that are trauma-informed. And it seeks to actively resist re-traumatization. So, how does an agency do that? How do we, are aware of not traumatizing the people that we're serving? So it's using an individual's strengths, for an example, to empower and then to develop their treatment options. It's informing them of all their options, so there are no surprises. It's being open, it's being trustworthy. It's when you don't know, and you're honest about it and you find the answers. But it's having clear expectations and also sharing with individuals the next steps that are coming up. So again, there are no surprises, because when folks are re-traumatized, sometimes they just quit coming into services, because if you're going to get traumatized in a treatment setting, then I wouldn't, it would take a while for me to go back to. So it also does things like keeping the parking lots well lit, the bathroom, thinking about where the bathroom entrances and exits are. It's using welcoming signage. It's making sure that when you're in a waiting room, or if you're in your, in an office, that people have a clear exit that they need to, when they can see a clear exit to get out of. So it's thinking along those lines will make an agency more trauma informed. And then also one thing that I thought was interesting when I was doing some research on trauma informed in the different agencies, it talks about rescreening and should be avoided, continuous rescreening, because sometimes those rescreenings might increase the potential for re-traumatization, and also that ample training should precede screening, so that folks who are doing the screening can be really aware of the trauma some of these folks might have incurred. All right, next, Vanessa. All right, so we talked a little bit about the 4 core values, and now we're going to talk a little bit about those 12 guiding principles. I believe we've talked a lot about that as we went on this half hour, but I'm going to share what these 12 guiding principles are. And again, a principle isn't a program, it's a way of thinking. A system of care guiding principles is a comprehensive array of effective community-based services and supports. So it's what we talked about a little bit earlier. It's not those fragmented service delivery system, but it's more of that coordinated service delivery, so that families might have one goal instead of 5. So that a family might have to go to 2 places instead of 7 within a week's time. A service planning process that is strength-based and individualized. Again, it's, talking to families and asking what's strong and not so much what's wrong. It's asking, it's seeing what's going good with the family. It's using their gifts as a way of helping them to get better. And when you know their gifts and their strengths, there's all kinds of different programs or ideas that you can come up with to help with, recovery goals. It's evidence informed and promising practices. We talked about our parent and youth and adult leaders in the service delivery. Peer support is evidence-based. And so, using all of those different practices that do work to help our families. Services and supports delivered in the least restrictive, most normative environments as possible. Talked a little bit about, hey, if you can't come to us, daggone it, we're going to come to you. So it partnerships with families, youth, and other caregivers. So what does that look like? It's relationships, it's relational. How do you partner? Well, you build relationships, you find out more about families, you look at their strengths, and you ask them what they want to do. They are the content experts on themselves, and they'll share with you what works for them. But we got to ask them, what's going to work for you? So a system that supports provider accountability and quality improvement tracking. We got to know if what we're doing is working, and we got to make it better. So cross-agency coordination, just working together, having those blended resources, effective care management supports. And as I was doing this today, I'm like, wow, what does effective care management supports look like? So I looked it up. And so what it is, it's family engagement, it's person-centered, it's transitional care, and that goes on in that care coordination. So it's really building up those engagements, the person-centered transitional care coordination. So it's developmentally appropriate services. You're gonna provide services different for a 5-year-old versus what you would a youth. And so, the appropriate services for the right population, a continuum of behavioral health promotion, prevention, early identification, intervention, and recovery services and supports. Oftentimes, and I'm going to talk about using family and youth in the service delivery, but oftentimes family and youth and adult peer support were put on the back end for crisis. So when there was a crisis that hit, we were called in. And so what we're doing now is we're moving family and youth and adult peer support to the front end, doing some in-reach and meeting folks where they are, and being an intervention and a prevention for them to go any further into different systems. So the protection of rights of children and families, and services and supports provided without discrimination. So those are your 12 system of care guiding principles. So we've got a poll question after hearing a little bit about the different system of care core values. How comfortable are you with your agency? How comfortable are you with the system of care core values? We've got a lot of folks that pretty comfortable. We've got some folks that vary. We've got some folks that not so much. Well, it seems like the majority of the folks are pretty comfortable with the system of care core values. What I would ask for you guys to do, or ladies and gentlemen to do, is to, think about these core values as you sit in your RIAC meetings. Look into it, research it a little bit, think about it more as a different way of thinking versus a program or, a plan. It's just a different way of thinking. Okay. So there is one more question. Which system of care values would you like more information on? And this is going to help us in our planning for future workshops. So it looks like, I don't know if you can see the poll. It looks like youth and family driven has, I can't really see, gosh, I need new glasses. It looks like youth and family driven along with, well, they look all evened out. I mean, there's not a lot of difference between all four of those. So, but we appreciate that feedback, because what we want to do is to be able to help, I don't know, be able to help inform, make aware, train more on, those values that you want to learn more about, so that you'll feel more effective in your role as you're working with the families and youth. Thank you, Vanessa. All right, so I'm almost done, so you don't have to look at me much longer. Okay, so I am going to go into real quick sustaining families and youth on RIAC. I know from being on several RIACs, we have some great parent and youth representatives. And then, there's other RIACs who are having it in their action plan and they're identifying parent and youth reps. And so I just want to talk a little bit about how to sustain family and youth reps, if you have them on your RIAC now, or if you are seeking to put them on your RIAC. So built on relationships. We talked about that a little bit earlier, how, in those system of care guiding principles, to partner, you need to build those relationships. So a welcoming environment, actively listening and exploring the family's area of expertise and interest ensure that families are engaged in ways that are meaningful and purposeful. So get to know who your families are. Get to know, the family strengths and the youth strengths. Get to know some of their values. Somebody even talked about, if I was in a RIAC and I didn't know anybody, name tag sure would be important, because that would have made me feel more part of. So I know we can't do really name tags now since we're on virtual, but if we ever get back to normal, to think about that and having some name tags, a good RIAC orientation, have the information about what a family and youth rep does, about the regional interagency council, and take time a little on the front end to support the parent and youth rep, because chances are they've not heard of a RIAC either. And so the confusion can be a little overwhelming at times. And I know that RIACs are sometimes so happy when they get a parent or youth representative, they come on board, and then it's business as usual. And it's like, well, good luck. And, and sometimes the families and youth don't feel as effective. So some of that extra support is needed to be able to, like we said, level that playing field so that families can feel like a true partner. Voices of family. So creative outreach strategies such as community events, focus groups, online surveys, and social media provide opportunities for the voices of all families to be heard. And so what we do once a month is we have a parent and youth representative monthly meeting, and it has all of the parent and youth reps in Kentucky that are on this meeting for an hour every month. And so we were talking last month and we said, we are the only voice that sit on the RIAC as far as parents are concerned, and they can know our perspective. But what about all those other families out in our communities? What are their perspective? And so tonight happens to be our next meeting. And so we're going to strategize on how we're going to, connect with other families in the region or in their communities, how they can connect so that they can bring a more collective voice back to your RIAC about what families and youth really need. And I don't know and I'm thinking about different ways and ideas, I know that a lot of mental health centers or agencies are, it would be really cool to have an advisory council of some kind. So maybe to have an advisory council where they can touch base with a lot of folks at one time. I don't know how we're going to do that, but we are going to, figure a way out to where we can get more voices around that RIAC table. Next, Vanessa. So equal partnership, listening and benefiting from each other's knowledge and expertise fosters equal partnership between families and systems. So, you know, the providers sit around, I mean, you guys are experts in what you do and in your field. And to really believe and have that thinking that the parents and the youth are experts on their lives and how we can learn from each other about how to get better. You know, like I talked about earlier, my son and I went on this journey together. And I had been through several different systems with him. And, you know, when you're going through the system with your youth, you know, you had to stand up a little bit taller. You had to speak up a little bit louder because you wanted those providers to know that your kid was so much worth more than what they're seeing now because they're not at their best. But there was one facility that treated us with respect. And there was one facility that treated us with, you know, honor and dignity. And they listened to what we had to say. And because of that, there was a true difference in the service outcome. And when it was all over with, I sent that person, I sent that agency flowers because I was like blown away by, I contributed to helping them save his life. He was that bad at that point. Then I was at another system where it was horrible. And I wouldn't, you know, I wouldn't want my, you know, kid to go back there. I wouldn't want anybody's kid to go back there with the experience that I had. So it does make a difference in that partnership with families, and you can help to, you know, really make that difference. It really made a difference to me and mine. So support participation, assistance with transportation. I know that you all do that as a RIAC. You reimburse for childcare, translation services if needed, the use of technology, especially now for families to participate. So, you know, support that participation in whatever that might look like to help families and youth be able to sit around that table in partnership and share their voice. So acknowledge your expertise, because, you know, when we're sitting around the table or when I'm at RIAC, I know I'm getting paid. You know, I'm getting paid for my time doing this. And so, you know, I get paid for my expertise, and families need to get paid for theirs. So, and that is one way that we do it, is to financially compensate for their time, effort, energy, and voice. And then also having those opportunities to grow, providing leadership opportunities to families and youth as you see it. You know, we get a lot of things across our email that might really benefit the families and youth that we serve. So to be able to get families and youth to conferences, trainings, to encourage them to be on the monthly parent and youth rep calls, to build knowledge, and so that they can feel successful in their role as a parent and youth rep. So give them those opportunities to grow. There's families and youth out there who are biting at the bit to try to make a difference. And so it's up to us to ask, identify, and then help to plant the seeds to help them to grow. And I think that is it, Vanessa. And I thank you all for your time.
Thank you, Joy. So we are going to move on to RIAC membership. Our councils are made up of family and child serving agencies within our communities. We have mandated members on our RIACs, and those mandated members are, these are members that are legislated to participate on the RIAC. They are the Children's Services Director from the Regional Community Mental Health Center or their designee, a court designated worker or court designated specialist, a special education cooperative representative with behavioral health experience, a parent of a child who is raising or has raised a child with mental health or co-occurring mental health and substance use challenges, who has been or is a client of at least one service to address these challenges prior to their child being the age of 21. So this parent that we're talking about must be a biological parent, adoptive parent, or relative caregiver with permanent custody. We also want a parent alternate that meets the same criteria as the parent representative. A transition age youth representative between the ages of 16 and 25 who has a behavioral health disorder and who is receiving or has received a service to address mental health, substance use, or co-occurring mental health and substance use disorder, again, before the age of 21. A transition age youth alternate that meets that same criteria, and then a representative from each of the following agencies: Department of Juvenile Justice, Family Resource Youth and Service Centers, Local Health Department, Kentucky Office of Vocational Rehabilitation, and the Department for Community-Based Services. One thing too, RIACs are chaired by one member chosen by the majority vote of the members. So the chair prior to 2018 had to be a DCBS representative, but that is no longer the case. The chair just needs to be a member, a voting member of the RIAC as selected by the RIAC. If you are not seeing these individuals on your RIAC, please reach out to their agencies and invite them to come. The Department for Behavioral Health is also available to support RIACs with representation from these mandated agencies. I know in the past, there's been a time or two that we have reached out to SEAC members for support, and they have been wonderful with helping us to identify members in all regions of the state from these agencies to be able to serve on the RIAC. So please reach out to us and let us know if we can help. Also, for the parent and the youth rep and the alternate, the RIAC is required to provide at minimum a $50 stipend for each RIAC meeting that the RIAC parent and youth representative and their alternates attend. With that said, the RIAC should also budget additional funds to support the parent and youth representatives and their alternates and mileage reimbursement to meetings once we're able to travel again. Regional family and youth leadership development opportunities, including registration fees, their time. We want to compensate them for their time, just like we would be paid to go to a meeting or a conference, and their travel expenses. Childcare expenses. If they need someone to be able to watch their child while they attend RIAC, we want to be able to cover that. Family members' participation on FAIR team. And then attendance of the parent and or youth representative and their alternates to relevant activities or meetings at the request of the RIAC. So for example, if you want to send your parent, if the RIAC votes to send the parent, youth, or the alternates to the System of Care Academy this summer, that's something that you would want to make sure that you compensate them for. And before we move forward, I just want to make sure that employees of the Community Mental Health Center or other RIAC member agency cannot serve in the role of parent rep, alternate, or youth rep, alternate. Along with our mandated members, we also have non-mandated members. So the RIAC may choose to add non-mandated members to the RIAC that represent other agencies that provide services and supports to children and transition age youth with a risk of developing behavioral health needs. This should occur by majority vote of the RIAC members. And all members, your mandated members and your non-mandated members, are included in the RIAC's quorum when conducting RIAC business. So a quorum of the council exists if 55% or more of the total members are present. And so RIAC meetings are open to the public. Agencies may attend RIAC meetings to learn more about the local system of care, to share information about their services and supports while not becoming a voting member. A lot of times on RIACs, you have guests that attend routinely, and that is completely fine. But if it looks like somebody who wants to become a part of it, talk with your RIAC about that. Make sure that they know that the commitment is that they're going to be attending monthly. And we'll talk a little bit more about RIAC expectations and member expectations here in a second. But just, again, they can continue to attend as a guest if they would like to. So right here is a list of suggested non-mandated system of care partners that we encourage be invited to RIAC. But it's not limited to those on the list. What I would like you to do, and Lee, you'll have to help me here because I can't see the chat box, but I'd like for you to type in the chat box either suggestions that you have of non-mandated members or guests that could attend your RIAC, or non-mandated members or guests that maybe aren't part of this list that you have on your RIAC already. So if you have ideas about who could come, or if you already have these people on your RIACs, but they're not part of this list that I've put up here. So just take a few minutes and put that in the chat box.
No one's typing anything
No
yet.
one's typing. At a lot of the RIACs that we, wake up everybody, we need a break. At a lot of the RIACs that we attend, we do see a lot of MCOs on there. Some have people from the mayor's office, some local hospitals, local colleges, Boys and Girls Club, the regional prevention centers. CASA is a new agency that has recently joined RIAC meetings, independent living coordinators. Again, it's not limited to this group, but those are definitely non-mandated members that we encourage be invited. Did we have any takers on that?
Yes, now we do. As you were talking, people started to chat in. So we have YMCA, faith-based law adoption agencies, teens, centers for accessible living. Someone said MCOs are present, the mayor, teachers, shelters at times come. That's at, in our Pathways region. CASA is a good idea. Volunteer groups here are geared towards helping youth and families. Another MCOs, Big Brothers, Big Sisters, county extension offices. It's a good one. Kentucky Career Center, foster care agencies, independent living programs, Voc Rehab attends ours, someone said. Family Scholar House, which I don't think is across the state, but I do think that's in Jefferson area. Substance abuse treatment providers, Job Corps, CARES. I don't know what CARES is. That's all caps, so that must be an acronym. The Targeted Assessment Program through UK, DCBS calls them TAP. After school programs, doctors, Beside You for Life. I'm not familiar with that one. That one may be in Jefferson too. Crossroads, pregnancy agency. We're getting a lot now. School-based personnel and additional to the youth services center reps.
Those are all
state parks.
Wonderful suggestions and wonderful, suggestions to invite these members, or not these members, but these entities to your RIAC. And just to let you know too, as we stated, they can attend as guests. If they start to come more regularly, you can talk with your RIAC about possibly adding them as a voting member. And depending on what your area of focus is, you may have some non-mandated members that are only present for a period of time, depending on what you're focusing on. And so that's okay too. And it's okay to have that conversation with an agency. For example, depending on what your area of focus is, if you feel like this agency over here would be a good stakeholder, invite them in, tell them what you're working on, ask if they'd like to participate. Tell them that if it's time limited, that's completely fine, because we're going to have people coming and going depending on what we're focusing on at the time and what goal we're trying to reach. So thank you all for participating in that. Moving on to RIAC member responsibilities and expectations. When we provided the registration and the survey to see what everyone felt like was important to be added to the agenda, this is one of the things that got a lot of votes. And so it's important that as RIAC members, we know what's expected of us and what our responsibilities are. So the very first one being to attend monthly meetings. RIACs meet monthly, usually for about an hour and a half to 2 hours. And sometimes there's some subcommittee work in between, but they do meet monthly, and your attendance is very important. And for consistency purposes, this should be the same member every month, or the agency can designate an alternate. The alternate should be the same person too. And some RIACs have MOUs in place with their individual agencies. So their agencies know that this person has been designated as the regular member and this person has been designated as the alternate. And those two should have conversations about the RIAC business that's occurring. So if the alternate fills in, they're not starting from scratch, walking into something where they don't really know what the area of focus is and where they stand in that, but just again, that conversation to occur so progress can move forward. So designate an alternate in the event that the RIAC member cannot attend. And again, ensure that the alternate has been updated on RIAC business to keep the council moving forward. Actively participate in developing solutions to identify system level barriers for children and transition age youth. So as a member, you're looking at the data at your agency and you're looking at the trends and you're talking with the populations that you serve to see what those needs are. And you're bringing that information back to the RIAC for discussion. And right below it, provide local agency data to assess, support identified gaps and needs and successes. Maintain expertise and respective agency service availability so you can share that information with others on the RIAC to be able to service that community linkage. Maintain expertise in navigating the rules and regulations of the respective agency and facilitate access to services as appropriate.
Vanessa, before you move on, we had a question in the chat box and you don't have to answer it right now, but keep this on your radar. Do any of the RIAC survey providers in their region about access to issues, barriers, etc.?
Okay, let's just go ahead and talk about that for a little bit. That's a great question. And yes, we would love for RIACs to do that. When we talk about data, and Tina's going to talk a little bit more about this in a second, but when we talk about data, we're not just talking about the data that our agency collects, but we're also talking about working with the population, surveying, having focus groups, pulling that information in from the community to really see what those needs are, and then bringing that information back to RIAC and voting, and maybe using additional data too to see trends that support what we're seeing, and then voting as a RIAC where we're going to target those efforts at. So did that answer that question?
He said yes. He wanted to know if RIACs already did that. And you gave a great synopsis of that.
Okay, and so every RIAC does it differently. We have some RIACs when they are deciding on an area of focus. Some of them, it seems like they automatically do focus groups and they survey or they meet with, of course, this is all pre-COVID, meet with youth and parents within the community or different agencies that work with those youth and parents to kind of see what the needs are. And then take that data, bring it back to the RIAC and so forth. So it happens. I won't say that it happens with every RIAC across the state, but yes, it does happen. All right. Member responsibilities and expectations. So RIAC members vote on the following items. And let me just say, your voice is so important. So as a RIAC member, you are voting on the direction of the RIAC. What's important to your community? Where are the needs? Where are the gaps? What's working well that can be expanded upon and shared with other agencies, other communities, or even across the state that would help to support the population of focus? You're voting on the action plan, including the area of focus and the action items that are going to get you to that end goal. You're voting on how to engage the community and community partners. You're voting on how to involve members in the action plan and in the efforts. You're voting on member responsibilities, grant opportunities as they come along. You vote on who is going to be the RIAC chair and the term of the chair. You vote on the parent and youth representatives and their alternates. There's actually an application that we have our parents that are interested in serving in that role, the parents and the alternates and the youth and the alternates fill out an application. They turn that into the RIAC. The RIAC reviews that and votes whether or not they feel like that person meets the criteria and or is a good fit. And then that application is sent on to SEAC for official appointment, but that's something that starts at the RIAC. They vote on adding non-mandated voting members. They vote on RIAC policies and procedures. They vote on sending members to training and covering the cost of professional development opportunities. And of course, the approval of minutes and adjournment. So one of the questions on the survey that we got was, how can we support the work of the RIAC? And again, I'm going to go back to consistency of attendance. And when your RIAC has their action plan and their area of focus, it's so important that you are there every month if possible, consistently attending those RIAC meetings to be able to continue moving forward that action plan and actively participating. Using data, again, from your agency to identify and or assess or support what's working well and what's not, support and encourage action plan follow through. This is something that sometimes I see as I attend RIAC meetings across the state, is sometimes we get really good ideas and we have a lot of momentum when we jump into it, and then we hit some barriers, and sometimes that follow through can be a little challenging. So just continuing to be there to support and encourage the follow through. Bridge the work being done by your agency to promote to the RIAC to promote system level work. So for example, I know that RPCs are working really hard to get the dinner table project information out. So as a RIAC and all the members that sit on the RIAC, how can you take that information and distribute it to all of the populations, the clients that you have, the families and children that you serve? So that's just one example. Expand your knowledge and align your efforts and your agency's efforts with the system of care core values and guiding principles. Joy did an excellent job of breaking all of that down for us. But that information, although it's important to the RIAC and everybody that sits around the table, what our hope is that each agency represented on the RIAC will take that information back to their agency, and their agency will begin to align their efforts with those system of care core values and guiding principles, so that in all of the work that we do, that we're making sure that it's youth and family driven, that it's trauma informed, that it's community based, that it's culturally and linguistically responsive. Because we're not just keeping it here as a secret, we want to make sure we're expanding it. Promote system of care core values and guiding principles, again, across the community, and provide education across all sectors regarding ways in which supporting the system of care can benefit the entire community. RIAC coordination and facilitation. So each RIAC has 2 leaders that provide coordination of the RIAC and facilitate meetings. However, all members are responsible for the work of the RIAC, because I know sometimes we have such wonderful leaders in those positions. We think, oh, they can do it. But the reality of it is, it does take a village. And so we want to make sure that everybody is responsible for the work being done. But every RIAC has two awesome leaders. And so that one of the leaders is the LRC, and they serve as the only staff to the RIAC. They are not a member, but they do coordinate the work of the RIAC. They provide support to the chair, and they do not have a voting voice. So the LRC also is responsible for working collaboratively with RIAC members, community partners, and the Community Mental Health Center and other provider agencies to identify service gaps and work strategically with partners to find solutions to the gaps. They are also responsible for maintaining the action plan and ensuring that every member has a copy of that action plan at all times. They communicate the RIAC action plan efforts, the progress, the barriers, and opportunities for growth to necessary parties, including the RIAC and to the Department for Behavioral Health. So that action plan is sent to the department at minimum on a quarterly basis, unless there are significant changes, and then it can be sent more often, but at least quarterly. They provide administrative support to the RIAC, including direct support to the members. So if you have new members that join the RIAC, whether it's somebody replacing a mandated member agency, or it's a new non-mandated member agency that you voted in, or somebody that's just been coming to RIAC that wants to know more about it, it's that person who is responsible for making sure that they get the materials that they need and the information that they need to be able to know what RIAC does and how they can support the RIAC and contribute. They disseminate information from the department, from RIAC member agencies and or community partners to the RIAC, and they share RIAC information with their respective agencies. So again, when you come to RIAC meetings and you're working on your area of focus, it's very important that you're taking that information back and you're sharing it with your respective agency as well. Or during community updates, information that's shared, we want that information to be able to go back and share with your respective agency too. So everybody knows kind of what's going on. We're keeping everybody abreast of, you know, the needs and the services that are being provided, you know, in the community for this target population. The LRC works with the RIAC chair to develop the meeting agenda. The LRC sends meeting reminders and materials to members in advance of all meetings. Maintains RIAC meeting records and minutes. So every RIAC meeting, minutes should be taken and kept and shared with RIAC members and then sent to the RIAC administrator. Tracks mandated member attendance and non-mandated member attendance. And they contact those members that have missed 2 or more consecutive meetings to encourage their attendance. And they request representation from vacant member agencies if they need that agency representation to be filled. They oversee adherence to relevant Kentucky revised statutes and Kentucky administrative regulations and RIAC policies and procedures. They serve as a link for caregivers, community members, and the RIAC. They establish collaboration with community agencies and resources. And they work with the SEAC and RIAC administrators to facilitate bidirectional communication between RIAC and SEAC. If you've attended SEAC before, especially within the last couple of months, you know that we have invited RIACs to come and present on their RIAC COVID-19 funding opportunity proposals to tell and share with SEAC the projects that they've done and the impacts that it's made in their community. Also, when RIACs have worked towards their action plan and they've hit a system level barrier that can't be broken down, you know, at the regional level, we've had RIACs come and talk with SEAC about that to help break down those barriers. You've also heard me say a million times to not forget to send the minutes in, or make sure you send your action plan in, or when I get to pop into a RIAC meeting here and there, I'm taking notes, because what I'm doing is I'm using all of that information and I'm compiling a monthly report that is shared with SEAC on a monthly basis as well, that allows them to see what's going on within the regional system of care throughout the state. The LRC assists in locating, developing, and increasing awareness of local resources, services, and prevention tools. They ensure that RIAC members receive orientation and training. So whether it's an annual refresher that catches everybody that's joined that RIAC within the last little bit, or if it's, you know, I used to say having a cup of coffee before COVID, but if it's having a Zoom meeting or a phone call with somebody that newly joins, just to go over the materials that have been provided to all RIACs on just that RIAC overview of what the purpose is and why we do what we do and who we work with and what our goals are. But just making sure that they have that information so that we can work to keep them engaged. Also, it is the responsibility of the LRC to attend quarterly RIAC leader peer group meetings. Those usually occur in March, June, September, and December. To attend SEAC meetings, we'd like to see there at a minimum quarterly. And also attend fair team meetings or designate an alternate to attend from the RIAC. And lastly, monitors the RIAC budget and expenditures and shares this information with RIAC members. So as you can see, with the LRC being staff to the RIAC, they have a lot to do. So they need your help in getting and working on this local system of care and working towards those areas of focus in the action plan. Your other RIAC leader is the RIAC chair. And so the RIAC chair is, again, voted on by the members by majority vote. The RIAC chair must be either a mandated or non-mandated voting member of the RIAC. They are responsible for facilitating the RIAC meeting. they are also responsible for providing local agency data to assess gaps and needs. And really that's every member's responsibility. They follow Robert's Rules of Order. They are also responsible for voting as a tiebreaker. They provide supports to the LRC. They ensure meeting focus and timeliness. They promote active involvement by members. So they assist the LRC with reaching out to those member agencies that maybe have been missing in action for a little bit. They are also responsible for attending the quarterly RIAC Leader Peer Group meetings, and again, SEAC meetings quarterly at minimum. And they are also responsible for reviewing and signing Form 131. That is the Impact Region-Wide RIAC Funds form. So this form is due with plan and budget in April, and then it's due semi-annually January 31st and July 31st. And so what this form captures is it captures the RIAC expenses regarding RIAC infrastructure and parent and youth, rep, and alternate support. And so those expenses. And so we've got one coming up at the end of January. And so if your RIAC hasn't had the opportunity yet to review this form, it might be coming through an email, but again, it's just reviewing the expenses and then the chair signs off on that. All right, duties and expectations of the RIAC. And so this is written into KRS. So by statute, RIACs are expected to conduct regional system of care planning and operations. So assessment and planning to build community capacity to provide effective community-based services and supports that are delivered consistent with the system of care core values and guiding principles. They are also expected to provide ongoing regional and local needs assessments across agencies, again, to identify the service gaps and or those community needs. They are expected to coordinate system level continuous quality improvement. So regularly reviewing that local, regional, or state level data and utilizing performance data to evaluate and strengthen the system of care. And we want to promote data-driven decision-making across agencies and in the community. They are also responsible for identifying and developing system of care expansion opportunities. So we want to develop ways to bridge service gaps, such as with flexible funding, with grant applications, volunteer efforts, and through creative use of community resources to increase access and availability of high quality services and supports. They are responsible for promoting system of care core values and guiding principles across the community, and providing education across all sectors regarding, again, ways in which the system of care can benefit the entire community. Initiating and adopting interagency agreements is necessary for providing services and supports to children and transition age youth with behavioral health needs by the agencies represented on the RIAC. Advise the SEAC regarding the system of care within the region, and ensure one or more RIAC members, again, participates on the FAIR team and collaborate with FAIR team members as appropriate to improve and promote the system of care. Duties and expectations continued. We want RIACs to be, we want the work to be outcome-based. We want RIACs to use evidence-based practices. We want to make sure that they are using local and regional data from child and family serving agencies to drive the work of the RIAC, as well as other data that we've talked about. And again, Tina will talk about this more, but surveys, needs assessments, and so forth. But data should be used to determine the gaps, needs, the barriers, or what's working well that can be expanded to other agencies, communities, or regions. And we want each RIAC, and it's not just that we require each RIAC to have a current action plan that includes the current area of focus as chosen by the RIAC members. And so that action plan is used to guide the regional system of care development and implementation. And it's always evolving. It's never a one and done. And it should be updated frequently based on the progress that's being made, or if barriers have been hit, and maybe we need to kind of back up and rethink our strategies, but it's always evolving. RIAC members, mandated and non-mandated, they do meet monthly for at least 1.5 to 2 hours. This is not a lot of time. And so again, sometimes subcommittees have to be developed in between meetings to expedite the work. And And the majority of the RIAC meeting should be devoted to addressing the current area of focus and the action plan progression. Okay, so on my screen right now, you see a plate with food. Hope everybody had some lunch already. When I was growing up, my sister, Debbie, always knew exactly what she wanted to do. She knew from the get-go that she was going to be a registered dietitian. And as she got older, she wanted to become a certified diabetes educator. And so now she's one of only a few in the state who has that title. So I'm very proud of her. But with that said, growing up, we always called her the food police because regardless of what you had on your plate, she was always telling you you weren't supposed to be eating this or that, or you needed to have more fruits and vegetables and less meat and less carbs. And so when I think about how a RIAC meeting should look, I think about the plate method. And so this is the plate method. So if the plate method is a simple visual way to make sure that you get enough non-starchy vegetables and lean protein, and you limit the amount of higher carb food that has the greatest potential to spike your blood sugar. So again, when I think about RIACs, I think about the plate method in the same manner. So the food on our plates and the portions support our nutritional health, which supports our overall health. The different components of our RIAC meetings support the overall success of our RIAC and the local system of care. So all components listed above, such as the action planning and the community updates, and looks like I need to put there we go, and the presentations, they're all important pieces of the RIAC meeting. But portion matters. And if we're not spending a good portion of our meeting on our action planning, then it's very unlikely that progress towards the identified goals, needs, gaps, services are going to be made, thereby affecting the overall regional system of care. So again, portion matters. We want RIAC meetings to be structured so at least half, and you can see here my vegetables, at least half of our RIAC plate includes action plan. And then the other pieces of our RIAC meeting, of course, community updates, they are so important because we need to know what's going on in our community. We need to be able to take that information back to our respective agencies so we know the right referrals to make. Presentations are important too, especially if new services move in or if there's a new agency that you learn about. But again, we want to make sure in general, when we're designing our agenda on a monthly basis, that we're looking at this method here and we're saying, okay, have we devoted an ample amount of time to our action plan so that we continue moving forward the targeted goal? Okay, so we've got another poll. This is the moment of truth. It's anonymous. Do you feel that there is ample amount of time spent on the RIAC's action plan at your monthly meetings?
As we were watching the results come in behind the scenes, I'll just say that this is the fastest that you guys have voted.
We need a drum roll.
That's you, Tina. You did that.
This is the easiest question you've had yet.
Oh, look at that.
I see. So there are 65% of you that feel like yes, and 22% that say no. Again, I would like for you to make it your goal when you go to your next RIAC meeting, really, take note, think about the things that are being provided during that meeting. And again, all of those pieces are important. They help to make the system of care healthy, but we want to make sure that we have enough time to put towards that action plan so that we're constantly moving forward and making progress. Thank you all for participating in that. That was fun. All right, so Like I said, we use data from the last RIAC workshop, and the data stated that we needed a break. And so we're going to take a 10-minute break. So it's 2:35 right now. So please come back at 2:45 and we will continue on. And we are actually going to be jumping into using data to drive the work of the RIAC with Dr. Tina Robbins.
All right, we got to be serious.
All right, I'm going to go ahead and turn it over to Dr. Tina Robbins. She is an executive advisor with the Department for Behavioral Health, Developmental, and Intellectual Disabilities.
All right, well, thank you, Vanessa, and thank you so much for inviting me to be a part of this conversation today. So Vanessa, when they did the survey, one of the areas that folks indicated that they would like to have a little more technical assistance and information around is about how to have more data-driven conversations and during the RIAC meetings, and how to include data as part of the action planning process. And I have to say, I really appreciated Vanessa's plate analogy. I think it is so critical that we truly devote the time to the action planning and the implementation process that ensues. And so what I hope is that some of the tools and information that I share with you today will be helpful in making those conversations more data-driven. And so let's start with having you put something in the chat. And I would like for you to just type in the very first word that comes to your mind when you see or hear the word data.
Yuck, fear, Zoom, boring. Numbers, number overload, statistics, boring numbers, Star Trek.
Star Trek,
Stats,
I like it.
Information, outcomes, direction, excitement to learn, stressful, interesting, science.
Mm-hmm.
Computer.
All right, we have some data geeks in the group too. That's good. All right, well, thank you all so much. If you can see the chat or listen to what Lee rattled off, you'll know that, not that you were rattling, Lee, I'm sorry. What Lee shared is that data, many folks do associate data with something confusing or boring, or they just kind of shut down. And so what I hope to do today is to give you some tools, as I said, that will help make these conversations about data a bit easier and more relevant and helpful to your RIACs. And one of the simplest words that I saw folks put up that I think is right on target is data is information. It's just another way of sharing information with folks. And so that's what I hope that you will be able to take away from today's session. So what I want to do today is to talk with you about a simple 5-step process for how your RIAC can make better and more frequent use of data throughout your action planning process. And as Vanessa said, you should be spending the majority of your time as a RIAC either creating your action plan, implementing your action plan, reviewing your action plan, or revising it. And so your role, your primary role as a RIAC really is as agents of systems change, so that we can have a system of care that meets your mission. And so let's review a little bit based on what you've already heard in today's workshop about what ways data are an integral part of the system of care work and the work of the RIACs. And so you may recall that one of the system of care guiding principles indicated that a system of care is a system that supports provider accountability and quality improvement tracking. And so Data obviously is an integral part of that guiding principle for a system of care. Vanessa reviewed some of the RIAC member responsibilities, and one of those responsibilities was to actively participate in developing solutions to identified system-level barriers for the population of focus. And so to be able to develop solutions and identify system-level barriers, you must have data, you must have information about that. And you can certainly rely on your intuition, but it's a much more reliable source of data if you can gather that information from the folks that are part of the system. And so another RIAC member responsibility is the provision of local agency data to assess and support identified gaps and needs. And so again, you have a responsibility as a RIAC member to bring some of your local agency data to the table to help build that bigger picture of what's happening within the system. Vanessa also reviewed how you can best support the work of the RIAC. And one of those was through active participation. And there were a couple of data relevant ways to do that. Again, using data from your agency to identify and or assess and support identified gaps and needs within the system of care. And to also promote data-driven decision-making. And so by attending this session today, you are supporting the work of the RIAC because you're going to learn about how to follow a 5-step process for more data-driven decision-making during the RIAC process. Data is also integral to all 4 of the primary RIAC functions, conducting a regional system of care plan or conducting regional system of care planning and operations. Again, you must have information to be able to plan and to carry out the operations of the RIAC. You must have data to help coordinate system level continuous quality improvement. That is the foundation of CQI processes, our data and information. Identifying and developing system of care expansion opportunities. Again, you would want information to be able to guide those processes and those identification of those opportunities. And promoting system of care awareness. You would need data information, if you will, about where there are gaps in awareness about what the system of care is about and how it can support folks. There were other duties and expectations of the RIAC that Vanessa talked about, being outcome-based. You can't really be outcome-based if you're not looking at your data in terms of what outcomes have been achieved. Using evidence-based practices. At the root of evidence-based practices is the evidence piece, which is the data piece. And using local and regional data from the agencies to drive the work of the RIAC, to identify gaps and needs and barriers, and to determine what's working well and what could be expanded. So I go back to what Dusty put in the chat box, which was the use of potential survey data for gathering information on gaps and needs within the service delivery system. And so it may be that you can make those determinations with existing data, but it may be that those data are not available. And so you would need to gather new data through potentially a survey or a focus group of some kind. And so I really appreciated Dusty including that and bringing that up, that sometimes there are situations where the data are not available to answer the questions that you have. And so you may need to actually collect new data. So I hope, so really the good news is that Vanessa laid that foundation earlier for you about the rationale for why using data is such an integral part of the RIAC process. So the 5-step process that you see here in this graphic, I hope you'll find it to be a simple and easy enough process that your RIAC can adopt it. So basically you start the process at the top of this graph by setting the stage. And I'm going to talk through each one of these steps in sequence, but just to give you an advanced organizer, you're going to set the stage. You're going to examine your data. You're going to attempt to understand those findings. You're going to develop your action plan, and then you're going to monitor your progress and measure success. And the cycle continues in that way. And so one of the things that Vanessa did mention earlier was the amount of time that RIACs spend together or are required to spend together in terms of their formal RIAC meetings, and that's in statute. But sometimes subcommittees and work groups, or whatever you may call them, need to branch off and do some additional work. So for some groups, RIACs included, they may decide to have a separate sort of data team that follows this process and then brings back the information to a larger group. So you might consider doing that with your RIAC, particularly if you have folks that are sort of data geeks and others that may be less so of that nature. But you could also obviously do this process as an entire RIAC. So I think that just gives you a little bit of flexibility in terms of thinking about how to get this work done. Next slide. So let's go back to step one in the graph, setting the stage. And here are some of the guiding questions for you to think about at this particular part of the process. So really, what is the question? And identifying the what question is really about crafting clear questions. And that's the most crucial step for enabling data-informed conversations to happen. You have to know what it is that you're really asking. And a lot of times as researchers or data folks, somebody will come to us and they'll say, I need to know about blah, blah, blah. And the question is so broad that we really have to kind of help them get at what it really is that they want to try to answer. So I want to give you a few sort of areas that RIACs might think about, types of questions, if you will, that RIACs can think about. So a RIAC may pose a question to assess population demographics, for example. So what do the data tell us about the racial makeup of young children in our region? So that's an example of a what question about population demographics. A RIAC may also have questions that assess perceptions. So an example is, again, what do the data tell us? I like to start my what questions with that. What do the data tell us about student perceptions of the psychological impact of virtual schooling? So that's another example of a what question that assesses perception. Many of the questions, for example, in the needs assessment idea that Dusty proposed in the chat would probably be more perception-based kinds of questions. You can also pose questions that assess performance. So you may have a, what do the data tell us about vaping use among adolescents and young adults in our region? So again, what do the data tell us? And then you would have your question crafted that assesses the performance in some way. And then you may have questions related to that assess programming, for example, or how well your programs are operating, or a particular service, how well it's operating. And so again, what do the data tell us? And then a sample question might be about the impact of grandparent support groups on decreasing caregiver strain. And so I hope that helps you to think about the different types of what questions that a RIAC may ask. And you can start very simple and or broad with a question. Maybe your general area of interest is vaping. I looked at some of your all's action plans, and I know that's an area of interest for some of you. But then you would want to begin to narrow that question down because narrowing it down makes identifying and interpreting your data clearer and easier. So if you can take me to the next slide, we'll do a quick review of some of the common types of data. And again, these are those categories that I talked about. You may have some demographic data, and here are some examples percentage of children in your area, in your service area, by age or by race or by ethnicity or by socioeconomic status and so forth. So these type of data are really describing, if you will, the individuals, or it can also describe organizations in the area. In terms of perceptual types of data, it might be things like parent perceptions of services or educational quality, or student reports of engagement in risky behaviors like the Youth Risk Behavior Survey, for example. So these data provide information on how stakeholders feel or what they observe. So again, it's perceptual in nature. And many of the surveys, if you will, that we ask folks to complete from time to time are often very perceptual, perception-based or impressionistic. We sometimes use that word. There are also performance type data. So some examples are percentage of youth who enroll in post-secondary educational institutions or who are employed post-graduation. So that's an indicator, if you will, of performance. The number of students deemed truant last quarter, again, another example of performance data. So these are data that give you information on how individuals are performing or on outcomes. We also have program type data. So it might be things like counselor to student ratios in schools, or the number of extracurricular opportunities that are available in a region, or the number of parent and grandparent support groups that are available. So these are data that give you information on how activities are conducted by an organization, or in this case, within the system. So I hope this will help you all, again, to think about the types of data that might be available. And if you don't mind, I'd like to ask you to pop in to the chat box just some of the common data sources on which your RIAC relies, or you could even put in types of data that your RIAC is currently relying upon. So let's just get a few examples of those in the chat box. Okay, KIP survey from the Regional Prevention Center, good, yeah. Family resource data, surveys and focus groups. CPS intake sheet, yes, we've used that for the System and Care 5 grant. DCBS data and family surveys, good, yeah. So we do rely a lot in our field on surveys. That is a great way for us to get information on folks who are experiencing the services or the service delivery system in some way. So surveys are often used in an excellent way for us to gather information. We also have more administrative type data like the DCBS data on placement rates and those kinds of things. Oh, good. Dusty tries to share data on implementation of educational programs. So perhaps the degree to which something is being implemented, or the fidelity perhaps would be an implementation type of data. Good. Data-based for grants with age, area, diagnosis, educational data, good. So excellent examples. So I love the variety of data sources and types of data that you all are already relying on. So maybe I can just stop now and you don't need any of the rest of this. Vanessa's saying no. So on the next slide, thank you all for putting that in the chat. On the next slide, this is a template. So again, I want to arm you all today with some tools that you can take back and use. So this is a template that your RIAC could use to assist you as you explore your questions of interest and determine whether or not you have some relevant data sources available to you, or whether you may need to engage in some type of new data collection. And so You know, again, once you've narrowed your what question down, you may find that you have information that can answer that question to your all satisfaction, or you may find that that you need to collect new data. And so, but this is a way for you to sort of assess your landscape, if you will, and to set the stage for that. So once you have set the stage, you've determined your what, I'm sorry, next slide. You've determined your what question. Now we're going to move into the second step, which is taking a look at your data, examining the data. And this is the part where some people kind of shut down or get a little nervous, or their stomach hurts, or maybe you even vomit when you see graphs and things like that. But hopefully we'll be able to move you past that during this process. So some of the questions, guiding questions for this stage in the process is, you know, what kind of snapshot observations can you make about the question that you posed? What are the patterns in the data that are evident? What are some of the strengths or challenges that arise from the data? And what are some of the limitations of the data that you need to think about? And so looking for patterns in the data and making what I call snapshot observations is the first step in answering your what question. So for example, for some questions, you may have data from one period, such as the current quarter, and that may be sufficient for your question. You may be interested in knowing, you know, how many children were placed out of home in the last quarter in your service system, or in your region. Let's use region. So for example, if the question relates to kids in out-of-home care, then again, you may be interested in just the last quarter of data. But your RIAC may be interested in more of a long-term look at placements. And so you may look at patterns of out-of-home placements over time, like over several years. So you would need, you know, multiple years of data to look at, and you may be looking for those patterns across a longer period of time. And so we know from looking at statewide data that out-of-home placement rates were trending upward and peaked in 2019. And so we at the state level have been interested in looking at data over a longer period of time. And we were able to look at some of those patterns and noticed that they're, not surprisingly, that there was a correlation between out-of-home placements peaking and the opioid crisis. And so that's a very kind of duh observation to make, but it just gives you an example of how you may just be interested in looking at data, a snapshot over a short period of time, or more long-term patterns. And it's only after examining the data that your patterns become apparent. So you may have more surprising kinds of patterns. You may, such as a steep increase in overdoses in a single year. Or you may have more expected kinds of patterns that are evident, such as increases in overdoses around the holidays or during other stressful times of the year. You know, certainly during COVID, we saw some of those, you know, more expected kinds of increases. Or you may see more repeated patterns where overdose rates stay similar in certain geographic areas each year. And so there are certain sort of what we would call repeated patterns, or you may see at certain times of the year, you know, you always see a peak in a certain pattern of the data. So during this step, it may be possible to begin characterizing your findings as either strengths or challenges. And this is really important from the perspective of your RIAC, because you want to be able to determine what those challenging areas are within the data, because that's what then drives your area of focus. And so a strength in your data are the results in the data that indicate a success, that things are going well, that you're, you know, people are satisfied if it's a perception type of question, or that truancy rates are decreasing in the, you know, and if you have a performance kind of question. But challenges in your data are when the patterns or the results indicate that something is blocking or limiting improvement. And that's what you all want to key in on and identify as your area of focus. Certainly while thinking about building on strength areas, but you're going to focus in and hone in on those challenges within your data. So for example, you know, you may be exploring suicide data. That may be, you maybe have a question about, you know, your what question may be about suicide rates. And you may make the following observation about a possible success. And I've got, this is totally fictitious data. I made this data up, but you may make an observation that over the period of 2016 to 2019, the number of suicides among youth declined by 10%. But you may also make the following observations that really illustrate a challenge. While the number of suicides declined between 2016 to 2019, the number of suicides among youth less than 14 increased by 5%. So do you see how overall there's a strength in the data? There's a pattern going in the right direction, if you will. But when you nuance your data, when you look at your data in a little more detail, you find out that that's not the case for all age groups. And in fact, there's an age group in there that's really showing an increase in suicide rates. And so that's where your challenging pattern emerges, and that's where you want to focus your attention on making change. So I hope that that distinction between strengths in your data and challenges in your data kind of help you think about how to hone in on what your work needs to be. And again, this was all fictitious data, so those percentages are just things that came out of my head. But I want you to notice that, you know, there's specificity and factuality and relatedness of those observations. So those are things that you have to think about. Now, you notice my caution statement there at the bottom about exercising caution in establishing causality. That's something that, you know, many of the types of data that we look at are strictly correlational. And we don't get, you know, we don't do a lot of examinations of data that allow us to draw causal statements like this happened because of this, or something of that nature, that it's more about these two things happened in unison, like the opioid crisis and an increase in overdose death rates. We presume that that's the case if we see patterns like that, but we cannot necessarily determine causality without some more rigorous kinds of experimental designs being in place. And so just a caution about causality there. On the next slide, you'll see a template that you can use. It's just very simple, but it allows you that when you're looking at some data that you can record your observed strengths, like that statement that I made about overall between 2016 and 2019, suicide deaths among our age groups decreased by 10%. You could put that in as an observed strength. But then in the next column, you can record your observed challenges. So while that strength was shown, the increase by 5% among the 10 to 14 age group would be listed as a challenge. And you can record all of your strengths and challenges in this particular chart, and then use that again, those challenges, to help you define what area you're going to focus in on. So again, simple tool, but I hope it can help you with managing your data and your interpretation of your findings. So the next slide, it takes us into step 3 of this process, and it's understanding the findings. And so some of the guiding questions for this particular step in the process are asking what the possible causes are for the observed patterns, or contributing factors. What are some of the factors that might have contributed to the challenges identified in the second step? And why might these challenges exist? And do you have data that support those possible contributing factors? And so observations are really the basis for identifying the driving factors that underlie some of the patterns, the strengths and the challenges that you may see in your data, and for informing your future action plans. And so, for example, in the previous example, that fictitious observation about suicide data may lead a RIAC member to say, now that we see that there's a challenge in reducing the number of suicides among youth less than 14, let's figure out why that's happening. So what is it that's blocking improvement in that area, for example? And so a key step in understanding your data results is to begin a discussion with your RIAC and interested stakeholders about one or two of the key challenges. So once you've recorded what your key challenges is, start small. It can be very overwhelming to try to tackle every single challenge that you identify in your data, because you all know that there are plenty of challenges, plenty of areas to work on. And that's why Vanessa, in her wisdom, had you all focus in on one or two key focus areas and not 50 of those, because it gets incredibly complicated and overwhelming. So if you do identify multiple challenges, you're going to want to prioritize and narrow it down to a couple of those so that you can go through this process in a very systematic way. So understanding why challenges may be occurring can help your RIAC address them, and really it's these driving factors that you all are going to identify and talk about as a RIAC that will be the focus of your action plan. And so, you know, one of the things that I want to share with you is a strategy for choosing your key challenges. So once you've recorded the different key challenges that you've observed in your data, you know, as I said, you're not going to have the opportunity to explore all of those or to try to address all of those. But what I would encourage you to do is to look at the challenges that are more actionable than others, and that also may have a higher priority for your RIAC, that are, you know, and that closely align with the mission of your RIAC. So what do I mean by actionable challenge? And this is really important. An actionable challenge has driving factors that your RIAC members can address or influence directly. So there are going to be challenges that are less actionable to your RIAC because your RIAC may not have any control over some of the driving factors. And that can get incredibly frustrating for you as a RIAC to try to tackle something that you don't have control over in terms of the driving factors, or that you can't influence. You may not have control over, but you should try to identify things where the driving factors, the things that are contributing to that challenging outcome, are things that you can have some influence over. And so, you know, things like lack of transportation options, like true infrastructure, if that's the driving factor and you have no influence over making sure the roads up on Greasy Creek are, you know, passable for people so they can get it, that's not, you know, that's not something your RIAC is going to be able to have a lot of influence over or to tackle directly. And so you're going to want to make sure that you're looking for actionable challenges that you can actually do some work around and have some influence over. And so once a key challenge has been identified, then your RIAC can start beginning to brainstorm on some of the possible driving factors. And one of the ways that you can do that is to ask a series of what I call why because questions. And so you have your key challenge, and then you say, why is this a challenge? and you start identifying possible reasons. Well, it's because, and then you identify your first potential driving factor. And then you say, well, why is that a challenge? And then you say, well, because of this. And then you say, well, why is that a challenge? And you continue that iterative process. And it helps you to hone in more closely on some of those driving factors that are contributing again to that key challenge. And so on the next slide, there's a diagram of an example, if you will, of a brainstorming session, a why because brainstorming session from the field of education. I just popped it in there so you could kind of see how a data team or a group like a RIAC can take a challenge statement and go through the why because cycle and then get down to those driving factors that you can then try to address through your action planning process. So take some time to go back and look at that example. I don't have time today to like take you through step by step, but I think if you look at that example, the why because cycle will make a little more sense to you. So please make sure you go back and take a look at that. So step 4 on the next slide is really about developing your action plan. And so careful planning helps data teams take the right actions to tackle the challenges that you've identified. And your action plan will typically have some short-term objectives and a long-term goal. And I believe that the format that you all are using has that same approach. And your short-term objectives allow you to track progress and identify steps toward that larger goal. So it kind of chunks it out in manageable steps. And then you need your long-term goals so that you know what it is that you're trying to accomplish in the end. And so again, clarity and agreement on the objectives and goals are so important, and you can improve that process. You can improve your clarity and your group's agreement on certain goals and objectives if you follow the structure of SMART. Now, you all have been trained on SMART objective development. I'm so glad that you have already been introduced to that. It was really smart of Vanessa to introduce you to the SMART structure for that. I'll be back. I'll be here all week. When you're thinking about developing your plan, you can think about those SMART objectives, but some other things that I think you need to think about, and we'll go through the SMART objectives and what that means in a little bit more detail in a minute, but other things to think about when you're creating your objectives around in your plan is time. So is it possible, given your time limits, if you have any, if there are certain time limits that have been imposed upon you, you have to think about that. Resources, do you have the necessary resources, including buy-in and all of those kinds of things to accomplish your objectives and your ultimate goal? Relevance, is the objective that in your goals going to affect one of those driving factors that you identified in that chain, that why because chain? If it's not ultimately going to impact that chain that you've come up with, then you're not going to get to that goal. And so it's so important that you think about the question of relevance. And then also data availability, going back to whether you have data available that will help you to know whether you've accomplished that objective or not, and to be able to monitor your progress. If the data are not available, then you may have to, as we talked about earlier, collect new data to help you know whether you're impacting that particular objective and goal. So strategies and actions really are the foundation of your plan. And then once those are determined, you can assess whether you have the time and the resources and the data that are available for those. So let's, the next few slides really take you through the SMART structure that we talked about. So goals and objectives need to be specific. They need to be measurable. On the next slide, Vanessa. They need to be action-oriented. They need to be realistic. Sorry, I'm not turning my pages. And they need to be timely. And there are notes on each of these slides. I'll allow you on your own to go through those and review those, because I know you all have had some specific training on how to develop SMART objectives. But on the next slide, there's yet another tool for you, a template that you can use that will walk you through some questions to help you determine whether your specific objectives on your action plan actually meet the SMART structure. So you can use this and as a guide. And so you may look at your first objective and say, does the objective clearly state what is to be accomplished? And you talk about that as a group, yes or no. If it's a no, then you're going to want to revisit the specificity of that objective. Is it measurable? Does the objective state how we will know when it has been accomplished? And so your objective should have something in there about how much or how many or by when. And again, if you answer no to that as a group, go back and revisit it and make it more measurable. Is it actionable? Remember the definition of actionable. Is it an objective that we have some influence over? Is it realistic? Can it be attained within the given time frame and within some of the time constraints that we may have? And is it timely? Is there an end date there? There's some additional questions that you should ask about each of your objectives. Which stakeholders need to be involved? What are the resources needed? What are some important dates that are associated with this objective? Are there certain milestones that we're going to measure along the way to make sure we're getting to our ultimate desired outcome for that objective? And are there some barriers that we should anticipate? And if so, how are we going to prevent those barriers or mitigate those barriers? Now, the good news is, if you'll go to the next slide, Vanessa, or actually the next slide, yep. Your all's template that you have, your new action plan that Vanessa's going to review in a little more detail later on, is very much structured already in this way. So it's pretty exciting that you already have this great structure in place to help you to organize your action planning and your implementation process. So you can see here your goal, your SMART objective. All the different activities can be listed here, and then it's got all the key elements across the top, including barriers and ways that you might mitigate those barriers. So you all are onto you're already off to a great start because you have a great template here that's very well structured to help you manage this action planning process. So the final step on the next slide involves the monitoring of progress and to keep your action plan on track and to measure your success. And remember, Vanessa said that, the biggest portion of your RIAC time should be spent action planning. And so this is part of the process as well. So revisiting your action plan, monitoring your progress, measuring your success, going back and changing things, maybe refining objectives if you find that you're not getting close to meeting your goals. All of that happens in this process. And so if a plan gets off track, you're not going to know that unless you're meeting together as a group and monitoring the progress toward that outcome. And so it might get off track because maybe there's some responsibilities by someone that have been dropped, or key staff have turned over, or there may be some unforeseen challenges that arise, like COVID, for crying out loud, that have gotten in the way. But the RIAC really needs to spend time during this step troubleshooting to determine what needs to be done to get your plan back on track. And so you've got to check in with one another pretty regularly and identify those challenges and make some changes in your action plan. As Vanessa said, it's meant to be fluid and a living, breathing document. But I also want you to take time to celebrate successes. That's an important part to do during this step as well. And then how do you measure success? So assessing your progress is essential in using data to achieve your desired improvement. So as an action plan is being implemented, it's important to assess whether those strategies are being properly executed and whether your goals are being achieved. And some action plans are going to be more short-term, and you can do some quick evaluations, like let's say you had an objective around resource distribution. Well, you can pretty quickly determine, did you distribute the number of food baskets that you had intended to distribute? But other action steps are going to need to rely, are more long-term kinds of action steps and are going to require more time to implement. And so, and to know whether you're making progress. So you may be relying on KIP data for one of your performance indicators, if you will, one of your indicators of progress. Well, those data are updated every couple of years. And so you may have, you may need to wait a couple of years to look at whether your data point has been impacted or not. And so just know that sometimes your progress, your measurements of success will be different depending on the nature of the particular objective. So I'm hoping that at some point we can spend a little more time together talking about continuous quality improvement processes and can dig a little bit more deeply. But today I just wanted to give you this 5-step process and some tools and templates that you can use, hopefully to be able to be more systematic with the use of data and to hopefully simplify and demystify the process of using data for folks on your RIAC. And I want to leave you with a quote that has to do with action. It's a Kennedy quote, and it's, "There are risks and costs to action, but they are far less than the long-range risks of comfortable inaction." And so I think it goes back to Vanessa's point about the importance of action planning being what the RIACs and implementation of your action plans being what the RIACs are all about. And so if you can apply this 5-step process, you're continuously going to be engaged in action. So I'll stop there. Was that my beeper was that my time limit? Yay, wow, that was cool. I will leave you with that quote, but please know that you can reach out to me at any time if you need assistance. Vanessa knows how to reach me, and I'll be happy to help in whatever way that I can. So thank you.
So Tina, thank you very much. And just to let everybody know, this PowerPoint is going to be provided to everybody along with the recording after the presentation. So you guys can go back and look at it and really take those tools and be able to use those tools on your RIAC. Speaking of tools, and Tina mentioned it, we do have a new and improved action plan. I want to thank Lee for working on this action plan for us to be able to make sure that it implements and follows the SMART goals and objectives. For the sake of time, we won't spend a lot of time on this, but I do want you to know that if you haven't seen it already, this action plan should be coming to RIAC near you soon, because it's supposed to be going into effect by the end of January. We've also developed an instruction sheet to go along with it to use as a resource. But we're very excited about this. We have used a couple of different RIACs as guinea pigs to see how it works as RIAC leaders are uploading that information into the plan to make sure everything moves like it's supposed to. But again, you will notice that at the top of the document, and that's what this snippet is here, that it does require you to list the area of focus and then the goal and then those objectives that we talked about. Also, we want you to be thinking on the front end about your evaluation plan. Now, your evaluation plan may change over time, but again, we want you to begin thinking about it on the front end. And then, of course, your evaluation findings, you won't know that until you start assessing the outcomes. We don't want you to be intimidated by this template. We want to keep it as simple as possible. What you'll do is you're going to use a new template for each area of focus. I know on the old action plan template that we had, anything that RIACs were working on, it was all included on that plan. We think it'll be a lot more simplified if each area of focus has its own template. We also want you to label your activities by the objectives that they support. So if you have 2 objectives, then when you go down on the activity description, objective 1, objective 2. So again, just really simple. I don't want you to think that you have to move all of your items from your previous plan to this new template, because for some of you that would take a really long time. And we know that that old action plan wasn't very user friendly when it came to inserting information and lining it up in the different columns. So just start where you are and let's just move forward. So for a little bit, we might be using 2 action plans, but that's completely okay. Something that we have found that simplifies things for RIACs and their members, if they make the plan available during their virtual meeting. So they're pulling it up, kind of like we've got the PowerPoint pulled up right here, and they're making changes, they're editing and adding progress and barriers and resources and all those kinds of things. So all that discussion is taking place during the RIAC meeting by shared screen. And that seemed to work really well. So just like we've mentioned before, our action plans are always evolving. It's not a one and done. So it's fluid and it's changing every time that you get together, because you should be talking about it and there should be some type of progress being made. And if it's not a progress, maybe it's a barrier, but just make sure that you're documenting that so that the work continues to move forward. All RIAC members should have a copy of the updated action plan at all times. Action plans are due to the RIAC administrator, which is me. They're due quarterly, so June, September, December, and March. And information from the action plan is used in the RIAC monthly report to SEAC. So that's another reason that it's so important to make sure that you're updating those. And just like Tina, as she was working on developing this presentation, she went to the shared P drive where we keep these action plans, and she plucked several and looked to see what RIACs are working on and what type of data that they're using. And as we've stated before, RIAC should begin using the new template by January the 31st, if not already. So I'm gonna go ahead and turn it over to Lee Taylor. She is our SEAC Program Administrator. So take it away, Lee.
Thanks. So as Vanessa discussed earlier, RIACs are tasked with operating as the local governing body for the system of care. RIACs provide structure for the coordination, planning, and collaboration of services and supports at the local level. And this is where we're really going to place the emphasis. It's for children and transition age youth with or at risk of developing behavioral health needs. I've heard Vanessa say it over and over again. There are a lot of things going on in the state, but where RIACs really need to focus in and make an impact is for the children and transition age youth with or at risk of developing behavioral health needs and their families. So the State Interagency Council for Services and Supports to Children and Transition Age Youth, known as SEAC, is the governing body of the RIACs and LEACs. And we use the definition of governance as decision-making at a policy level that has legitimacy, authority, and accountability. By statute, SEAC directs each RIAC to operate as the regional locus of accountability, directs RIACs to participate on FAIR teams. That's really important. And then SEAC it assesses the effectiveness of RIACs in serving as that regional locus of accountability for the system of care. So the SEAC, with assistance from me, the SEAC administrator, ensures periodic review of RIAC policies and procedures. So Vanessa and I work together and we make periodic site visits to RIAC meetings. Now, since COVID and everybody's meeting in the virtual world, Vanessa and I are able to attend much more frequently. Before, we were only able to get to RIACs once, maybe twice a year. So now we're sitting in, that's why you'll see us in your meetings so frequently. We're there to provide coaching and support to RIACs in the development of your action plan, provide technical assistance and support around policies and procedures that support the implementation of your action plan, and then ensure RIACs are implementing and periodically updating your action plans. So RIACs identify service gaps, needed supports, and work strategically with system of care partners to find solutions to those gaps. RIACs gets shared with SEAC every month. This allows for duplication of successes across the state. And RIACs play a vital role in being the additional eyes and ears of SEAC. When there are system level barriers, SEAC can address those at both practice and policy levels. And then also SEAC by statute submits annual recommendations about the system of care to the governor and the Legislative Research Commission. And ultimately the RIAC's work can impact those annual recommendations. Next slide, Vanessa. So as Vanessa already mentioned, she uses information gathered from RIAC visits, from RIAC meeting minutes, and updated action plans to inform SEAC of the effectiveness of RIACs. So per SEAC Policies and Procedures, she provides a monthly summary report to SEAC. So it's not just Vanessa saying, hey, I'm gonna do this report every month. This is actually part of SEAC Policies and Procedures. The summary report includes each RIAC's area of focus, overview of activities, challenges, and needs. In addition to the monthly report, Vanessa has the ability to request time on any SEAC agenda to discuss any successes or barriers. Vanessa makes it a point to highlight successes. Again, this is how a RIAC's work can impact the whole state. Oftentimes, other RIACs are able to duplicate the work of one RIAC, tweak to fit that region's needs. An example of this is when the Big Sandy RIAC presented their public service announcement at SEAC. This provided an attainable example of how PSAs can be created and shared virtually. Other RIACs are now working on PSAs around their area of focus. So as Vanessa mentioned way earlier in the presentation, over the last few months, RIACs have been added to the SEAC agenda each month to present their COVID-19 funding opportunity work. This has been very well received at SEAC, and we plan to continue this over the next several months. So if you haven't already presented at SEAC, stay tuned. Vanessa may be reaching out to you for an upcoming agenda. In addition to sharing the information with SEAC, the monthly report, meeting minutes, action plans, like Vanessa said, are stored within our department and often reviewed not only at our department level, but sometimes at a cabinet level. Our current Secretary of the Cabinet has an interest in SEAC, and if you haven't seen him, sometimes he pops into SEAC and attends those meetings. So just know that SEAC and RIACs have the focus and support even at the cabinet level. And if you've ever wondered if anyone knows what your RIAC does, they do. Your work goes way beyond your region, so keep up the good work. Oh, Vanessa, you're muted.
The word for 2020, huh? All right, sorry about that. I'm going to go ahead and turn it over to Ann Embry. Ann is the local resource coordinator for the Barren River RIAC, and I've asked her to speak with us today on collaboration. It's something that their RIAC has always done so well, and I just thought it might be best if you hear from her on how they're able to be so successful with that. So go ahead and turn it over to Ann.
Thank you, Vanessa. Like she said, my name is Ann Embry, and I am the local resource coordinator at the Barren River RIAC here in Bowling Green with life skills. Basically, my key is communication. I cannot stress how important it is for the LRC to provide communication with all of their RIAC members, their agency, other agencies. I mean, I guess as my role as local resource coordinator, I feel like I need to know, all types of things that I can forward to everybody and keep everybody in the loop. So I recommend always having an email group and making sure that you communicate with your RIAC, you value the members of your RIAC, and that you ask them what they feel like they can bring to the RIAC. I always just think communication. You can never communicate enough. And those of you that have received my emails know how when I send a lot, or when I'm on vacation and it's like dead silence. I think having that email group, making sure when you have members, and we've recently just started this, is to ask your members to share their agency. What can their agency bring to the table? What can their agency bring to our 10 county area, because we cover 10 counties? And every month I'm having a agency represent. I know a lot of different things about agencies, but things change so much. And in 2020, everything has changed. So I think it's really important to know what your members and what their agency can bring to the table. This orientation worked out perfect with us, because we are looking at our new mission, our goal, our objectives. So having all this was great. And I've had lots of RIAC members attend this. So I think that will really help with our moving forward on our specific goal, because I'm an overachiever. I admit it. Our plan has so many different areas of focus that it sometimes is overwhelming. And it sometimes feels like we don't really focus on one specific thing, but we're spread out. So I think, really getting your members, finding out what they can do. And I love hearing from them, getting their updates. Every month, I always include, what are your updates? What is going on in your agency? Just so they can and let people know. And I do have members who don't like to talk. So I ask them to email me, and then I will put it in the minutes and on the agenda so they can have their updates. Not everybody feels comfortable in talking. So you want to make sure you never want to put a member on the spot who is shy on screen. I know that it takes a lot to talk to a lot of people, but knowing how they feel comfortable, finding out their best communication. I learned this the hard way, is not everybody has email like we do. Not everybody leaves it up from 8 to 5 or on their phone. So finding out, is it best to text them or to remind them? I'm finding that out more with my peer supports, is they want to be texted. They don't always check their emails. So really finding out accommodations for, what works with them. Is the meeting times good for them? And getting their opinion. I tend to remind my RIAC, I'm just here to help you all. This is your group. It is the members group. So I think making sure they understand that you're here to make a difference, and all these wonderful things we've done in the past is because of your agencies, and just making them feel very important. Also, I think, and this has been great since Vanessa and Lee have been here, is going to other RIACs. Learning what other RIACs do. We had an I Hope grant, and we put together a toolkit, and I was able to physically go to so many RIACs in the beginning before COVID hit. And then even attending them virtually, so many RIACs focus so differently. And what may work in one area may not work in the other, but you get ideas. And I have gotten so many ideas from Donnie, and we had a previous LRC Clay, and just finding those things of what works, you can bring them back to your area in a different way. So getting to know your other LRCs, getting to know your RIAC chairs, and really just working as a team. I can't thank Vanessa and Lee and Dee Dee and Beth for all of the support they give. They are an email or a phone call or even a text away for anything. So make sure you use them, utilize those people. Heck, you can call me anytime. I would be happy to help anybody as much as I can. If I don't know the answer, I'll tell you, and I can lead you in the right way. I see Donnie on my screen. He's always very involved in everything. He can help. So just remember, there are so many different of us out here that do this that can learn from you. You can learn from us. So communication, teamwork, and another thing is make it fun. Make it fun and make it not boring. And I don't mean to say that any RIACs are boring, but we have all sat in meetings where, the leader of the meeting has no enthusiasm and no oomph, and it just makes the meeting boring. So as an LRC, even if you've had the worst day, go in there with a great attitude and make people smile, because if they believe in the LRC and the RIAC chair, I know that we will have a great co-adhesive meeting. And you got to have that energy, and you got to be positive, and you've got to look for things in the future and really not be negative. This is a great thing. And if you have members who are not engaging or not positive, then maybe just pull them aside and say, hey, is this meeting for you? Is there something going on? And just asking them. And sometimes it may be just they're intimidated. So I think really understanding your members, getting to know them personally, communicating and making it fun. And especially after 2020, I miss seeing people in person. I miss providing food and having that, but I feel like I have such better turnout virtual, that I have more people participate. So I will go back and say communication is the most important. And if you don't have that communication, then they're not going to know what to do. And as the LRC, it's my job to communicate, and I will. And I think all of you need to communicate. And if you're on my RIAC and I'm not communicating with you, please let me know, because I've had some computer issues. But I think that's it. I can't think of anything else. I feel like, I could probably go on and on and on, but I know there's a time limit. And I do thank Vanessa and Lee and Beth and everybody for all the support they give. If you don't personally know them, I suggest you get to know them, because they are an asset, and they will ask you to present and bring great things to the table. So thank you guys for everything you do for the Barren River RIAC.
And thank you. Go ahead.
I was just going to say, when you're ready, stop sharing screen.
Okay, I just want to say that Anne's right. Visiting other RIACs, I think it is key. And so if you get that opportunity while we're virtual, just to see how the other RIACs operate, it's very important. So just reach out, everybody. All the RIAC leaders have one of those RIAC leader contact lists. They can share that with you, and it includes the information so you can get in touch with those RIAC leaders to see when those meetings are, and so you can get the meeting link while we are doing everything virtually. So I'm going to stop sharing my screen so that we can show a little video here.
And just while I'm getting it ready to follow up on what Vanessa said, Vanessa's also created a RIAC page on the Department for Behavioral Health website. So now that leader list, as she updates it, it's going to be there on the website. So you don't ever have to worry about searching through your inbox. It's always ready for you. So, and Vanessa, as I get started, give me a thumbs up if you can hear this.
We've all had times when group work failed. People missed deadlines, failed to communicate, and didn't learn from mistakes. But chances are you've also been part of a team when you accomplished something epic together that you could have never done on your own. So what makes this creative collaboration work effectively? Well, here are 7 ideas. Number 1, ownership. Members need to be empowered from the start. Here they can solve problems, generate ideas, and design systems that lead to success. Number 2, dependability. Creative collaboration requires members to hit their deadlines and develop creative endurance. Number 3, trust. When members trust one another, they work interdependently. Here they genuinely listen to one another and assume the best in each other. Over time, they become transparent and even vulnerable. Number 4, structure. The structure should be loose and flexible, but You need to have structure in creative collaboration. It needs to exist. This is why I love design thinking. It's a flexible framework for getting the most out of the entire creative process. Number 5, a shared vision. I'm not referring here to vision statements that you put on a wall or slap onto a website. I'm thinking more in terms of a sense of direction. It's a shared desire, a goal that you're aiming for, and a picture of what you will produce. Number 6, fun. The best collaborative groups I've been a part of are the ones where you want to be together. They laugh, they play together, and this can actually boost both convergent and divergent thinking. Number 7, candor. This is one of the big takeaways from Creativity Inc., a book by one of the co-founders of Pixar. It's the idea that groups need to be honest about what's working and what's failing. And this honesty allows you to adjust and iterate and ultimately create something awesome.
We are running close to time. I had a few more slides. I'm not going to worry about sharing my screen right now. You guys will get this PowerPoint, and we'll share that video too when we share the PowerPoint. But one of the other questions I got on the survey is if we could provide information on previous and current RIAC efforts. I will say that our RIACs have done so much great work, and they continue to do great work in their communities. And so one of the best ways to see what that work is on an ongoing basis is to review that RIAC monthly report. It is always sent out with the SEAC information, and it's also sent out to all the RIAC leaders each month. So if they're not currently sharing that with RIACs, I think they all are, but just ask and they can send it to you. But it's got information on there about their areas of focus, the activities that they're doing to support it, successes, challenges, and so forth. So just make sure that you're reading that. I will tell you that most recently, we did have a couple of funding opportunities, one being the RIAC COVID-19 funding opportunities, and so many RIACs applied for that, and they were able to support their local communities with immediate and emergent needs. And there's been so many community partnerships established from those projects, which is really neat because these are community partners that may have not ever been part of the RIAC if it weren't for this funding opportunity and the work that the RIACs did. We've had other funding opportunities along the way that RIACs have jumped on to be able to support their local areas of focus. And again, we've invited RIACs to come and provide that information to SEAC just to share that information across the state. And some RIACs have been able to really make a difference in their communities, even without any funding from DBH. And some of the activities that I think about are like Montgomery County a few years ago, they were able to address the rising truancy concerns that they had in their area. And basically what they found is that doctors were providing school excuses for longer than what needed to be, the students needed to be out of school. And so the RIAC got together and they educated different doctors and physicians agencies within the community. And so they put an end to that. So you know, there's all kinds of wonderful things going on. But again, if you want to stay on top of things, I highly encourage you to use that RIAC report that you get each month. We are at 4:01, but I did say we were going to allow for a little bit of time for questions and answers. So let's take a little bit of time, if you have it, to stay on here with us. If you'd like to ask any questions or if you have any comments about anything that you'd like to share. And if you do, just unmute yourself, or you can put it in the chat box. All right, we have a question. How long are the terms? Are you referring to the term of chair or?
Yes.
Okay,
Yeah.
so we allow RIACs to establish the term of the chair. And so that is something that we would like for RIACs to have discussion on. And then once your RIAC votes on that, you can put it into your local RIAC policies and procedures. We had a discussion at a RIAC meeting this morning about that. That RIAC decided to mimic the policies and procedures of CIAC. So for CIAC, it's a 2-year term. I think they decided this morning that you could serve 1 consecutive term. So you could serve up to 4 years if you wanted to, if you were voted in by the RIAC. But that is definitely up to each RIAC.
Vanessa,
Yes.
it's Donnie. The
Hey,
one thing that I have found out that every RIAC is different. We do things well that others may not feel like they do as well, and vice versa. So I think everybody's doing really outstanding work, and anybody that calls me or emails me, I'm always there to help with whatever they need if I can help them. So I just appreciate everybody that has sang our praises up here with these PSAs and all this stuff. That, I mean, they've done our bunch has done a really good job. I'm proud of them.
And so one of the really neat things about getting to visit more RIACs as we're all meeting virtually is we get to throw names around more often. So we have sent a lot of RIAC leaders to other RIAC leaders. For example, Lee was talking about Big Sandy and the PSAs that they've done. I don't know how many times I've told people, go see Donnie Ray. They've done such a good job with their PSA. And I want to applaud you all for being able to help other RIACs, because that takes some of the work off us. And, you know, there are sometimes that we've been asked questions that I wouldn't even know how to help somebody with, you know, the question that they have. But I know that there's a RIAC who's done that, and I can send them their way, and they've been able to network. So we appreciate that. And I'll say this too, when COVID came around, you know, my biggest fear was that, you know, that the work that RIACs were doing was just going to become dormant. You know, would they continue to meet virtually? You know, how comfortable were people with virtual platforms? What was this going to look like? But RIACs, you know, jumped to the occasion. And although some things had to be modified, I mean, they stepped in and did more than I could ever imagine. And so again, they've been able to jump in, and even though they haven't been able to meet in person, they've been able to reach out to different community partners, assess what the local needs are, and to jump right on it and to be able to support their community. So we've been very impressed by that, and we really do appreciate it.
Well, some of us are more community people oriented, like Ann and I were, you know, I hate this virtual stuff, and I've had to get a whole training session. I've been to therapy, I don't know how many times over this daggone virtual thing. And I've had some people that's helped me along the way, and I think that's really what it's about. But I mean, I see a lot of good stuff going on out there. It's I mean, because we need to continue to do a lot. We got a lot more going on, and a lot more crazy stuff that's happening every day that and I don't know when it's going to be over. I hope it's over soon, but God bless everybody out there working.
And you're right, Donnie. I don't think our work will ever be done. There will always be something to work on or towards. But we've got a bunch of experts across the state that can do it, and that are very passionate about their work. And we're just grateful to have these people on our councils. All right. Are there any more questions or comments? All right. Well, I want to thank you all for hanging in there with us today and for participating. We will get the PowerPoint and all the materials associated with it out tomorrow to everyone. We will also send the recording. So if you want to share this with RIAC members or community partners that couldn't make it today, and have them watch it in between a RIAC meeting, so you can come back to the next RIAC meeting and debrief. I think that would be a great idea. Also, I will say this, with the surveys that we had with the registration, there were a lot of different needs that were requested on there. Of course, we couldn't fit them all into an afternoon workshop. So what we are looking to do this first half of the year is to be able to take some of those requests and do like a lunch and learn, a monthly webinar for an hour to target what those requests are and bring everybody back together that is interested and available. So it wouldn't just be for RIAC leaders, but it would be for RIAC leaders, RIAC members, RIAC guests, and just, again, anyone that's interested and available. So with that said, I want to thank you all for your time, and Lee just posted in the chat box that we will also include a training evaluation. So that'll be sent with the email too. Please feel free to fill that out to let us know what we can do better. We value your input. You guys have a great evening and a great rest of the week, and we will see you at a local RIAC meeting soon.